So, first I'd like to ask your permission to use this video for educational purpose on the internet.
Yes.
What do you do? What's your hobby? What do you do for fun?
Motorcycle, snowmobiling, water sports.
Yeah, all the fun stuff.
Yep.
But you couldn't do that before our surgery for a while.
Very limited amounts.
Tell me about that.
A motorcycle, you could ride maybe 30 miles and I would have to get off because my back would start aching really bad.
Yeah.
Snowmobile.
How bad was the pain then when you would do that?
It would get to the point where my legs would go numb.
You had to stop.
I had to stop.
Okay.
Sometimes I couldn't feel the brake pedal. I knew my foot was there, but I couldn't feel it.
Okay.
Yes.
Now, the surgery was just 4 months ago.
Yes.
And this is what we did. We did a L4 to S1 fusion. Literally, we put spaces in, both beautifully starting to grow. The screws are all in a good place. And actually, bone as well start to grow in the back. Look at that right there. And here's the front view of that. How long did you stay in the hospital?
One overnight.
Just one night.
Yep.
And before the surgery, did you have leg pain?
Yes.
When did the leg pain go away?
Almost immediately.
Almost immediately.
Yep.
Now it comes to the real question. When did you go back to biking? Tell me about it. How
2 months after the surgery.
2 months after surgery. How did it go?
When I drove out of the driveway, you've got your little bit of curb height.
Yeah.
There was a little bit when that hit. That
You felt it.
felt it. It's like, well, you're not quite ready for this. The body did, but I did go put 10 miles on, and it was good.
Yeah.
Felt great.
Yeah.
And
So, I'd like to ask you for a favor. Can you send me a picture of you biking?
Yes.
Because that is sort of, I think most of my colleagues, people who do this for a living, know that there is a timeline to get back to certain activities.
Yes.
After open surgery, our patient don't feel like going back.
Right.
And they don't feel like that at all. But now, what did you find? What made you come to us?
Just the minimal invasive part of it.
What if your insurance would say you have to live with it? What would you tell them?
You go to the bank or something. Do
Some
something.
insurance say that they only pay for open surgery, where we cut you open, literally fillet you open, versus our surgery, because if you remember, you said you went home next day.
Yes.
After open surgery, you don't go home next
No.
day.
You have to figure out if you have the time available to take off work that it's going to take you to heal.
Yeah, I'm telling you that because actually your insurance is health partner, right?
Yes.
They just told us if you don't cut you open, if you don't fillet you open, we cannot do this surgery anymore.
Really?
So yeah, next year I could not have done this surgery for you. I only could have done an open old-fashioned surgery for you.
Isn't the fillet surgery going to cost more money than the minimal invasive surgery?
Overall.
They're going to have a lot more. People are going to be out of work longer,
Yeah.
and it's going to cost them more money. If it's going to cost more money for you to do the surgery, it's going to be a longer hospital stay.
Yeah.
So it's going to cost them more money in the long run. So that doesn't seem financially smart to me.
Yeah. We have a track record of 1,400 patient that patient recover faster. Our blood loss is 1/10 of the open surgery. Our infection rate is 1/30th of the open surgery. And it is, to me, baffling that they say you have to do open old-fashioned surgery. So, but you are one of their patients telling here you stayed one night in the hospital and 2 months later you are returning to your life.
Right.
Thank you so much. I appreciate it.